Hello. Today I want to talk to you about technology. How can technology change healthcare? How can technology help you to get medical access, to help your children when they're sick? And I think it's important to know that as technology improves, we can make medical care more affordable and more accessible to so many more people. I'm DrLuke. And I really want to share with you what the future of medicine might be looking like for you, for your family, and for people around the globe. So the video is going to be divided in two sections. The first bit is going to be how it works, what is an online doctor, what is online telemedicine, and the second part is going to be how can you actually access that. That is a bit more localized in specific countries. So I'm going to talk about our situation in South Africa and how you can access that. So be sure to watch to the end of the video so that you know how you can actually use this. Okay, so let's start. Telemedicine has been going for quite a while, and it has been initially very difficult. How to do it? Do we do it over our smartphones? Do we do it with a specific app? Is the doctor available? Who are you going to see? There were so many questions. It was difficult to connect because connection was an issue with bandwidth and with availability, and you can't have video and you only have audio. So there was many limitations, but as technology just grows and grows, we can really start using this as a platform to help people. So there's two ways of doing this. You can do what we call a peer-to-peer telemedicine, which means you as the patient connects with a doctor, mostly through your smartphone or through your computer, and you can ask certain questions. The doctor can give you some answers, and if possible, get you or send you a prescription to be treated. That's a good option. It's the way that it developed, and it's also a way that some people can get really good information. It's much better than just going to Google and ask something you're not sure, what answer is the correct one. You get all these millions of answers from the worst to almost nothing. So I think it's great to have access to a medical specialist or medical person that can answer your questions. However, if you have something physically wrong with you or with your child and you're not 100% sure and it's not so easy for the doctor to know, it's a great way to have contact with a medical professional like a registered nurse, because they are very well qualified. They know their patients, they know their culture, they know their environment, they know the diseases that happens around them, and they can really provide a very good base from which the doctor can work. And I think that is something absolutely that is happening more and more, and it's something for the future. So what can you expect when you work with a registered nurse that gets a doctor online, rather than just a doctor one-to-one on your smartphone or on your computer? You go to a participating clinic or pharmacy where there's a registered nurse that can see you as a patient. So the sister or the nurse that is working there will get a thorough history from you. She will do a basic examination, and she can do a whole lot of vital signs that can be put on the platform, so that when the call gets logged for the doctor to come on board, he already has a lot of information. So what would we expect? We would expect the sister to do your blood pressure, your pulse rate. We would expect her to do your oxygen levels, O2 saturation. She can do your height. She can do your weight. She can do your sugar levels. She can do a urine test, which very often is very important to know. She can do a cholesterol test. She can do an HIV test, if that's relevant. There are so many things that she can do. You even get kits that can test your PSA levels. You get kits that can do your uric acid. So in patients that have a gout history, she can access that, have a look at that. She can do a peak flow if they want to evaluate your lung function. That can be done. These are all tests that are very easy to do on a clinic primary care level. So once this information is all set into the platform, what the sister does, she contacts the doctor, or she puts the patient in what we call a queue. So the doctor's on the platform, takes the next patient that is in the queue and comes onto the big screen, introduces themselves like, good afternoon, good morning, I'm Dr. X, and nice to meet you today. I see sister's taken a history of yours already, and you have a problem with diabetes, or you're struggling with a tonsillitis or a middle ear infection, or you've got a chest with a phlegmy cough that's not going away. Let's see if we can help you. The doctor can then review all the vitals that the sister's given him. It is also very important for the doctor to look at your history. So we need to get your medical history that the sister will put in for him, your medication. Let's say you're on some chronic medication. The sister can put it all down so that we know what you're using. Allergies, it's important to know whether it's medication or something else. Surgery, previous operations. So she can really get a very thorough history that the doctor can evaluate very quickly and then decide on what the appropriate treatment would be. So what the doctor will do next is confirm the diagnosis. If there's any extra investigation or examination that he would like from the sister, she can do that. She can listen to your lungs, she can listen to your heart sounds. What is also very important is we have special cameras that can take a picture of the tonsils, of the eardrum, of a skin rash. All can be uploaded onto the platform so that the doctor is able to see what is going on. So next step is to do your prescription. So your script gets done online. If you need a sick note, the doctor can do that. It's also important to know that you might need a special investigation. You might need a blood test. You might need an X-ray. So a letter can be written for X-rays or for some blood tests, or even if you have to go to hospital or be referred to another doctor to see in person, that can be done with a referral letter. So as you can see, it's really very comprehensive. The sister would then print that out, give you your prescription. You can go to the pharmacy, get your medication, and get treated straight away. Yes, there might be some limitations to this, and you don't have the doctor right next to you, but with a well-qualified registered nurse or nurse practitioner, you can really go a long way in bringing affordable medical care to so many more people across the country, across the continents, across the globe. The general question is always, but how accessible is it really? So in South Africa, as an example, it will cost you about half a normal doctor's consultation. Also, the medication that's given is given on a formulary that allows it to be a lot more affordable for you to get as patient. The clinics that are available are in pharmacies because they have to give the medication. And I think the main thing what you can do as a patient is look out for pharmacies that have a sign outside that says teledoctor or online doctor available. That is how you will know that this is a place where you can get help. It's also good to say that this is not to replace the role of a doctor that you would normally see in person. This is very much filling a gap for so many people that has not seen a doctor, that does not actually have the ability to see someone from a financial point of view, from a transport point of view. It's really important that you need to know that in our rural areas there are fewer and fewer doctors available. And because there are fewer and fewer doctors available, you need to bring the care, the specialist, the good care to the primary care level where there's not enough help available. So I hope this has been very helpful to give you some insight on what telemedicine is. Originally, when you start and you see it the first time, it's a little strange, it's a little weird, but the help that it can give is of great value. If you think that someone that might find it interesting, please share the video. Please subscribe down the bottom so that we can spread the word. Click like, and you can even make a comment so that we can get it out there, that more people will know that there is really help available for them, and it is affordable, and it can make a real difference in their lives. Thank you for listening, and remember, stay healthy.